Hello everyone. In this video, I am going to talk about finasteride. This drug is available in different strengths, each indicated for different clinical conditions. It is well known by its brand name, PROPECIA, where it is available at a strength of 1 mg. It is also available with another brand, PROSCAR, at a strength of 5 mg. In this video, I will discuss the pharmacology of finasteride. We will see how finasteride works for hair loss and prostate enlargement. We also discuss important precautions and possible adverse effects of this drug. How to take this medication and its pharmacokinetics will also be discussed in this video. Androgens play a key role in the development of male sexual characteristics, including hair growth. Testosterone is one of the primary androgens present both in men and women, with more pronounced action in men. Within the body, it can be converted into another androgen, dihydrotestosterone, commonly known as DHT. This conversion is mediated by one of the enzymes, 5-alpha reductase. In a few people, the activity of this enzyme is enhanced, resulting in increased levels of DHT, leading to prostate enlargement and male pattern hair loss. Finasteride can reduce DHT levels, thereby reducing systemic complications. Finasteride is classified as a 5-alpha reductase inhibitor, and this drug is chemically a 4-azasteroid. A similar drug in this category is dutasteride, with the same suffix steroid. 5-alpha reductase exists mainly in two types, type 1 and type 2. Type 1 enzyme is mainly expressed in sebaceous glands on the skin, scalp, and liver. The type 2 5-alpha reductase enzyme is expressed in the prostate, hair follicles, seminal vesicles, and epididymis. It also coexists with type I enzymes in the liver. Another type of this enzyme is also expressed ubiquitously in many locations, including the prostate and hair follicles. Finasteride is a selective inhibitor of the type 2 5-alpha reductase enzyme, thereby reducing DHT levels in the prostate and hair follicles. It also shows some activity on the type 3 5-alpha reductase enzyme. Elevated levels of dihydrotestosterone may result in many of the systemic effects, and among them, two are clinically more important. In the prostate, it mainly results in enhanced growth, leading to enlargement of the prostate. This results in an elevation of total prostate volume, commonly known as TPV. In healthy people with an average prostate size, this normal TPV is 25 milliliters. But in patients with enlarged prostates, this volume may be increased by more than 30 milliliters, resulting in a condition called benign prostatic hyperplasia, or BPH. This condition results in increased urinary frequency at the same time that urinary flow is reduced, leading to a weak stream of urine. Due to prostate enlargement, a small volume of urine may leak out, and if left untreated, it may also lead to significantly reduced urine output, resulting in urinary retention. Sometimes, this necessitates surgery to avoid further progression of BPH and related complications. A second effect of raised levels of dihydrotestosterone is observed on the hair follicles. DTH can have a harmful effect on hair follicular growth, resulting in increased hair loss. In a few men with a strong family history of hair loss, the type 2 5-alpha reductase enzyme is more expressed, resulting in increased levels of DHT and precipitating androgenic alopecia, also known as male pattern baldness. Since finasteride reduces DHT levels in the body, it can be used in two conditions. This drug can be used to treat benign prostatic hyperplasia, where it can improve the symptoms and reduce the development of acute urinary retention. It can also be used to treat male pattern baldness, where it may reduce androgen-induced hair loss. As it can be used in two different settings, the dose of this drug is also different. It is given at a dose of 5 mg once daily in cases of BPH, while it is used at a dose of 1 mg once daily for the treatment of androgenic alopecia. Let's see how to take this finasteride. As we have seen earlier, the dose of finasteride is different for the treatment of BPH and androgenic alopecia. For the treatment of BPH, this drug can be used either as monotherapy or combination therapy. As a monotherapy, finasteride is given at a dose of 5 mg once daily and can be taken either with or without food. Finasteride can also be combined with alpha blockers in patients with moderate to severe BPH. It can be combined with doxazosin, where finasteride is used at a dose of 5 mg and doxazosin at 4 mg, both combined in the same pill. Combination therapy is preferred in patients with mild to moderate BPH and a total prostate volume of between 25 and 40 milliliters. It can also be used in severe conditions of BPH with a total prostate volume greater than 40 milliliters to reduce the risk of acute urinary retention. For the treatment of male pattern alopecia, finasteride is given at a dose of 1 mg once daily. Continuous use of finasteride is recommended for at least 3 months to observe any beneficial effects. Now let's focus on how finasteride works in both of these conditions. Testosterone is converted into dihydrotestosterone by the 5-alpha reductase enzyme. Within the body, around 10% of testosterone is converted into DHT by this enzyme. DHT is the active form of testosterone, and both hormones can produce their androgenic effects by acting on androgen receptors. Therefore, within a tissue, testosterone can activate androgen receptors as well as DHT. But which predominates in its action? DHT is the stronger one, and it results in a long binding with androgen receptors, producing more pronounced hormonal effects. So in those tissues where DHT is more readily formed due to enhanced activity of the 5-alpha reductase enzyme, significant androgenic effects can be observed. One of the important effects is observed in the hair growth cycle. Normally, hair follicular growth is observed in various phases that extend over a time scale of 2 to 6 years and end with the shedding phase, resulting in the loss of hair. In people with normal levels of DHT, it is followed by another cycle of hair growth, replacing hair loss with new hair. But in patients with elevated levels of DHT, the hair growth cycle is shortened, leading to an increased rate of hair fall. It also increases the time for new hair growth, resulting in reduced replacement with new hair. Elevated levels of DHT can also result in the shrinking of hair follicles, resulting in the development of brittle and thin hair. Another effect is observed on prostate growth. With raised levels of DHT, more growth factors are released, resulting in an enlarged prostate. Now, if we see what happens at the cellular level, testosterone can enter the cells, which are expressed with the 5-alpha reductase enzyme. Within the cytoplasm, testosterone is converted into dihydrotestosterone by this enzyme. Since DHT is more active, it can bind to the androgen receptors that are coupled with a protein called heat shock protein 90. By binding DHT to the androgen receptors, HSP90 is detached, and androgen receptors are internalized into the nucleus. There, they undergo dimerization and are coupled with coactivators. This results in the interaction of this complex with a specific region of the DNA responsive to antigens. This region of DNA is known as ARE, androgen responsive elements. By interaction with ARE, gene transcription is initiated, releasing mRNA that codes for many of the proteins. This mRNA then undergoes translation in the ribosome, releasing various types of growth factors and proteins. The effect of these mediators depends on the location. In the prostate, they produce prostate enlargement, whereas in the hair follicles, they produce thinning and loss of hair, leading to alopecia. Now finasteride blocks type 2 5-alpha reductase enzyme activity, thereby inhibiting the synthesis of DHT. This reduces androgenic effects, relieves symptoms of BPH, and reduces hair loss. Now let's see what types of precautions should be taken with the use of finasteride. The first important consideration is the effect of finasteride on pregnant women. Actually, this drug is only intended for use by men and is not indicated for women or children. Even though this drug is taken orally, the handling of finasteride is also an important concern for pregnant women. Normally, these tablets are coated with a protective film that prevents direct exposure to this drug. But any contact with crushed or broken tablets by pregnant women may increase the risk of consumption, which particularly affects male fetuses. Any accidental consumption of this drug results in androgenic effects on the male fetus, resulting in the development of abnormal genitalia in the male fetus. So care should be exercised while pregnant women handle this drug. Also, care should be taken with young women who are liable to become pregnant in the near future. Another important precaution with finasteride is that it may affect levels of prostate-specific antigen, PSA. PSA levels are variable with age. In men with ages between 40 and 60, the normal range of PSA falls between 0.6 and 0.7 mg per nanoliter. In men with an age greater than 60 years, the normal range is between 1.0 and 1.5 mg per nanoliter. In a few of the conditions, this PSA value is altered based on the prostate size. In patients with benign prostatic hyperplasia, PSA levels are elevated along with an increase in the prostate volume above 30 milliliters. Similarly, in prostate cancer, PSA levels are elevated. Finasteride can reduce the prostate size, thereby reducing PSA levels, which may mask the presence of prostate cancer. Therefore, while using finasteride, PSA levels are checked for at least 6 months, and any increase in the lowest PSA value during the treatment may indicate a chance of prostate cancer in the patient. The use of finasteride in men may produce few morphological changes in the breast. It can develop breast enlargement, tenderness, nipple discharge, a lump in the breast, and nipple pain in men. Finasteride, when used at a high dose, such as 5 mg, for longer periods greater than 7 years, may result in the induction of high-grade prostate cancer. So care should be taken with chronic use of this drug at high doses. Now let's see the adverse effects produced by finasteride. Since this drug affects the action of androgens, adverse effects are also related to this hormone. Finasteride can cause loss of libido, sexual desire, low ejaculatory volume, and ejaculation problems. All these may result in impotence in men. These side effects are more pronounced in patients with BPH, where finasteride is used at a higher dose. As cited earlier, this drug can also increase breast tenderness and enlargement. Hypersensitive reactions like skin rashes, urticaria, are also observed with this drug. Chemical form of finasteride. Finasteride has a steroid nucleus that is modified at the 4th position such that carbon is replaced by nitrogen. So finasteride is a 4-aza steroid. This steroid ring is attached to an amide chain substituted with a tertiary butyl group. Pharmacokinetics of finasteride. Finasteride shows good oral bioavailability, and from the dosage form, around 65% of the drug reaches the systemic circulation. Food doesn't have any effect on the bioavailability of this drug. So it can be taken with food, or it can also be taken without food. Use of finasteride results in a 90% reduction of DHT levels, thereby reducing prostate size and prostate volume. It is extensively metabolized within the liver by the cytochrome P453A4 enzyme, and its metabolites are around 20% active compared with the parent molecule. These metabolites are excreted by the kidneys into the urine. One of the advantages of this drug is that in patients with renal failure, finasteride can still be used at a normal dose. Dosage adjustments are not required as the metabolites are excreted through feces in such patients. So that's all about the pharmacology of finasteride. Thanks for watching this video. Don't forget to hit the like button if you really enjoy this video. Please subscribe to my channel and stay tuned for another interesting topic. Until then, have a nice time, take care, and goodbye.